What if the spice rack the Prophet Muhammad, peace be upon him, kept was never lost, it was simply forgotten? The Prophet's, peace be upon him, pantry held one spice that modern medicine has spent more than 2,000 peer-reviewed studies trying to understand. The classical Muslim physicians from Ibn Sina to Ibn al-Bayṭār prescribed it for inflammation, joint pain, the liver and the heart, 1400 years before peer-reviewed journals existed. That spice is at number 1. Welcome back to the Prophet's Pantry. Last time we explored the 20 Sunnah oils. Today, 20 Sunnah spices. Tibb an-Nabawi, prophetic medicine, is the body of healing knowledge that flowed from the Medina pantry through the Indian Ocean trade, the Persian apothecaries, the Levantine kitchens, and the Andalusian physicians. We anchor on Ibn Sina, Ibn al-Qayyim, Ibn al-Bayṭār, and the great Muslim physicians whose work preserved this wisdom for 1400 years. We are transparent in this video. Most of these spices do not have a direct Sahih Hadith naming them as remedy, but they are catalogued, classified, and prescribed in the classical Islamic apothecary. And peer-reviewed researchers are now confirming what those physicians wrote down. Before we begin, subscribe and tap the notification bell. May Allah bless your home through this knowledge. Bi-ithnillah. Number 20. Sesame seed. In Arabic, simsim. On the Prophet's Pantry, we explored sesame oil. Today we cover the seed itself, which carries the lignans, the calcium, and the fiber that the oil leaves behind in the press. The Muwatta of Imam Malik records sesame as a Medina pantry commodity, a Sahaba-era kitchen staple. Ibn Sina catalogued sesame as warming, moistening, and nourishing, recommended toasted and ground for absorption. Modern research is early but consistent. A 2025 grade-assessed meta-analysis in nutrition and metabolism found sesame supplementation significantly improved blood pressure, glycemic control, inflammatory biomarkers, and lipid profile. A 12-week trial in postmenopausal women on 30 grams of ground unhulled sesame showed a 12% increase in serum osteocalcin, a bone formation marker, and a 9% decrease in bone resorption, the highest plant source calcium per gram. Sprinkle whole or toasted on dishes or use as tahini. Safety note, sesame is a top 9 allergen. But the next item, a spice with one of the strongest blood pressure trials in the entire natural medicine literature. Number 19. Hibiscus, or karkade as it is known across the Egyptian and Sudanese Muslim world. A note of transparency, hibiscus is not a Sunnah-era spice. It entered the Muslim apothecary through the African and Egyptian traditions, classified by later scholars. We include it because the Islamic heritage of healing extends far beyond the Medina-era pantry. 2022 Nutrition Reviews meta-analysis of 13 randomized trials, pooling over 1,200 participants, found hibiscus tea significantly reduced systolic blood pressure by nearly 7 points and diastolic by over 4 points. The effect size is comparable to a mild antihypertensive medication, not a replacement for first-line drugs, but a documented adjunct. The active compounds are anthocyanins and hibiscic acid. Safety caveats: avoid concentrated hibiscus in pregnancy due to uterine stimulant activity in animal studies, and consult your physician if you are on antihypertensive medication because the effects stack. Brew 2 grams of dried hibiscus flowers in hot water for 10 minutes. But the next item, the smoky dark cousin of the green cardamom most kitchens know. Number 18. Black cardamom. In Arabic, Hil Aswad. Distinct from green cardamom, a different genus and species, Amomum subulatum versus Eleutheria cardamomum, and the active compound profile differs significantly. Black cardamom is dominated by 1,8-cineol at 60 to 80% of its essential oil, the same expectorant compound in eucalyptus. Path A on the Hadith, Ibn al-Bayṭār and the later Persian Tibb scholars catalogue cardamom species without distinguishing them clearly. But Indo-Pak Muslim cooking has used black cardamom for centuries for warming meat dishes and respiratory comfort. Modern human research on black cardamom specifically is smaller than on green. Be honest about that. A 2026 trial documented improvements in cognitive focus with black cardamom extract. The compound one, 8-cineol, has documented antimicrobial and expectorant activity. Use a single pod in slow-cooked stews or steep crushed in hot water. But the next item, the spice the Sahaba kept for digestion and modern medicine is now testing for fluoride toxicity. Number 17. Tamarind powder. In Arabic, tamar hindi, literally Indian date. On the Prophet's Pantry, 5.1 we covered tamarind seed oil. Today we cover the pulp and powder. The form Ibn Sina prescribed for digestive complaints, bile imbalance and fever. Ibn al-Bayṭār and al-Razi all catalogued tamarind extensively. The Indian Ocean trade brought tamarind into Medina and through the entire Muslim world. A 2025 randomized trial in Food and Function documented tamarind pulp's effects on glucose and lipid markers. And one of the most surprising findings, a 2002 paper in the European Journal of Clinical Nutrition documented tamarind pulp's binding effect on fluoride, increasing urinary fluoride excretion in subjects with chronic fluorosis. Active compounds include hydroxycitric acid, tartaric acid, and polyphenols. Safety caveats. Tamarind interacts with blood thinners and may lower blood glucose, so diabetics on medication should monitor. Use a teaspoon of paste in warm water or as a tart base for sauces. But the next item, a kitchen herb with one of the cleanest period pain trials in the literature. Number 16. Dill seed. In Arabic, shibit. Path A. There is no direct hadith naming dill. Ibn al-Qayyim catalogues shibit in al-Tibb al-Nabawi for digestion, lactation and infant colic. Ibn Sina catalogues it similarly. The Sahaba-era Levantine kitchens kept dill for digestion. Modern research is real and clean. A 2014 randomized trial published in Pakistan Journal of Pharmaceutical Sciences compared dill seed extract to mefenamic acid for menstrual pain and found equal efficacy with fewer side effects. A 2020 trial in type 2 diabetics showed dill seed significantly improved glycemic control. A 2021 systematic review confirmed lipid-lowering effects. Active compounds carvone and limonene. Carvone also appears in caraway, which we will cover next. Use whole or crushed seeds in cooking, or steep 1 teaspoon in hot water as a digestive after meals. But the next item, dill's botanical cousin, with a different active compound and a documented IBS trial. Number 15. Caraway. In Arabic, carawiyya. Distinct from cumin, different genus, different species, same Apiaceae family. Caraway seeds are darker and crescent-shaped. Path A. Ibn Sina catalogued carawiyya extensively for digestion, lactation and infant colic. Sahaba-era Mediterranean staple. Modern research is solid. The German preparation called menthacarin, peppermint oil and caraway oil combined, has been studied in multiple randomized trials for irritable bowel syndrome and functional dyspepsia. A 2022 meta-analysis confirmed significant symptom reduction versus placebo. A separate trial documented caraway oil applied as a warm poultice over the abdomen improved IBS symptoms. Active compound carvone in higher concentration than dill, Use 1 teaspoon of seeds steeped in hot water or chew a small amount after meals. But the next item, the lacy red covering of the nutmeg seed, a Sunnah-era trade good from the Indian Ocean. Number 14, mace. In Arabic, bisbasa. Mace is the lacy red covering of the nutmeg seed, distinct from the nutmeg itself, which is at number 13. Both come from the same Indonesian tree brought into the Muslim apothecary through Indian Ocean trade. Ibn Sina catalogued mace and nutmeg separately for digestion and warming. Modern research is mostly preclinical. Be honest. A 2020 dossier in evidence-based complementary and alternative medicine documented mace's antimicrobial activity against H. pylori. A safety note before we go to number 13, mace contains the same myristicin and elemicin compounds as nutmeg in lower concentration. We will cover the safety implications in detail at number 13, where the doses become consequential. Use mace sparingly in cooking, a 1/4 teaspoon ground into stews. But the next item, the spice that ICU doctors have documented as the cause of dangerous toxicity at the wrong dose. Number 13, nutmeg. In Arabic, Jawz al-Tibb, critical safety item. Nutmeg contains myristicin and elemicin, psychoactive at high doses. Ibn Sina catalogued nutmeg as warming, drying and beneficial for digestion and sleep in small quantities. Indo-Pak Muslim cooking has used nutmeg for centuries in milk preparations for sleep. Here is the hard line. 1 to 2 teaspoons is the therapeutic culinary ceiling. A single tablespoon, about 5 to 7 grams, can cause acute nutmeg toxicity with hallucinations, tachycardia and seizures. Multiple medical case reports document this, including a 2023 case published in the Journal of Pharmaceutical and Biomedical Analysis of a teenager who consumed 75 grams and required intensive care, and a 2024 case in Cureus of a child who entered reversible coma from a small overdose. We are not recommending nutmeg as a sleep aid in any heroic dose. A 1/4 teaspoon grated over warm milk before sleep is the classical Tibb preparation. Modern research on lower doses documents anti-inflammatory and sleep-supporting effects. Respect the dose. But the next item, a Mediterranean gum with one of the cleanest H. pylori trials in modern gastroenterology. Number 12, mastic gum. In Arabic, mastica. Mastic is the resin of the Pistacia lentiscus tree, harvested on the Greek island of Chios since antiquity, a Mediterranean Muslim heritage trade good. Ibn Sina catalogued mastica extensively for digestion, oral health and stomach ulcers, recommending it as a chewing gum. Modern research is striking. A 2010 randomized pilot in phytomedicine documented mastic gum significantly reduced H. pylori bacterial load in infected patients. A 2026 trial published in the Indian Journal of Gastroenterology confirmed mastic gum as an effective adjunct to bismuth quadruple therapy for H. pylori eradication. A 2003 trial documented mastic chewing gum significantly reduced dental plaque. Active compounds include masticadienonic acid and isomasticadienonic acid. Safety note: Anacardiaceae family allergies may apply, the same family as cashews and mangoes. Chew 1 to 2 grams as natural gum or take encapsulated for stomach use. But the next item, a Mediterranean kitchen leaf with a real diabetes trial behind it. Number 11, bay leaves. In Arabic, waraq al-gar. From the Laurus nobilis tree, the Mediterranean Muslim kitchen kept bay leaves for digestion, respiratory and joint care. Ibn Sina and Ibn al-Bayṭār catalogued bay leaves extensively. Modern research is concrete. The Khan 2009 trial in the Journal of Clinical Biochemistry and Nutrition gave 40 patients with type 2 diabetes 1 to 3 grams of bay leaves daily for 30 days. The treatment group saw glucose reductions of 21 to 26%. LDL cholesterol dropped by 32 to 40%. Triglycerides dropped 25 to 34%. A 2017 postprandial trial confirmed cookies enriched with bay leaf extract reduced glucose spikes. A 2025 study documented bay leaf effects on non-alcoholic fatty liver disease markers. Active compounds, eucalyptal, pinene, and parthenolide. Safety note: do not swallow whole bay leaves. They are choking and intestinal hazards. Remove before eating. Add 1 or 2 leaves to slow-cooked stews and discard. But we're halfway through the list. Pause here. Notice what we are doing. The Prophet's pantry holds the spices the Sahaba kept in trade, the physicians prescribed in the apothecary, and modern peer-reviewed research has now studied. We anchor honestly. Most of these have no Sahih Hadith. They have Ibn Sina, Ibn al-Bayṭār, the Andalusian pharmacopoeia, and the Sahaba-era trade routes. If this is teaching you something, hit the like button so it reaches more Muslim families. Number 10. Star anise, Indonesian origin, brought into the Muslim apothecary through the Great Indian Ocean spice trade. Ibn al-Bayṭār catalogued Chinese star preparations. Path A on Hadith. Critical safety distinction: Chinese star anise, Illicium verum, is safe and is the primary natural source of shikimic acid, the precursor compound for the antiviral drug oseltamivir, marketed as Tamiflu. The flu medication you may have taken is built from a Sunnah-era trade good. Japanese star anise, Illicium anisatum, is neurotoxic, and the US FDA has documented contamination cases, including infant seizures and liver failure. Buy verified Chinese star anise only. Never give star anise tea to infants of any species. Modern research documents Chinese star anise for antimicrobial, antifungal, and anti-inflammatory activity. Use a single pod in slow-cooked dishes or steep 1 or 2 pods in hot water for adults. But the next item, the pungent gum the Indian and Persian Muslim apothecaries kept for IBS. Number 9. Asafoetida, in Arabic hiltit, Persian and Indian Tibb tradition, pungent gum resin from the Ferula asafoetida plant. Ibn Sina catalogued asafoetida as anti-spasmodic and digestive. Indo-Pak Muslim cooking has used asafoetida for centuries to ease the gas-producing effects of legumes and to support digestion. Modern research has caught up with a fresh trial. A 2025 randomized, double-blind, placebo-controlled trial in medicine by Das and colleagues documented asafoetida significantly improved functional dyspepsia through the gut-brain axis. Active compounds ferulic acid and sulfides. Safety caveats: raw asafoetida should not be given to infants under 1 year due to methemoglobinemia risk in case reports. Pregnancy caution due to uterotonic activity in animal models. Use a pinch in cooked dishes. The heat reduces the pungent compounds and brings out the umami. But the next item, the Indo-Pak digestive seed that shares its active compound with one of the most studied herbs in the Mediterranean. Number 8. Karom or ajwain, in Arabic nankhwa, Indo-Pak Muslim heritage digestive seed. Ibn Sina catalogued ajwain for digestion, respiratory complaints, and antimicrobial use. What is striking is the chemistry. Ajwain's primary active compound is thymol, the same compound that makes Mediterranean thyme work. Different plant, different cuisine, same molecule. The Mediterranean Sahaba kitchen and the Indo-Pak Muslim subcontinent independently arrived at the same thymol-bearing herb. Modern research is real. A 2016 trial in Neurological Sciences documented ajwain extract significantly improved neuropathic pain. A 2024 trial documented ajwain for taxane-induced peripheral neuropathy in cancer patients. Active compounds thymol, P-cymene, and gamma-terpinine. Use half a teaspoon of seeds toasted and added to lentil dishes or steeped in hot water with a pinch of black salt. But the next item, the Indian Ocean cousin of ginger. Number 7. Galangal. In Arabic, Kulanjan, the Indian Ocean cousin of ginger. Galangal is Alpinia galanga, while ginger is Zingiber officinale, the same Zingiberaceae family, different genus. Galangal is sharper, more pine-like, and has a different active compound profile than ginger. Ibn Sina catalogued galangal extensively for digestion, respiratory, joint, and warming uses. Modern research is smaller than for ginger, be honest, but real. A 2017 trial in the Journal of the American College of Nutrition documented galangal extract improved mental alertness and sustained attention, independent of caffeine intake. The active compound is 1'-acetoxycavicol acetate, ACA, distinct from ginger's gingerol. Anti-inflammatory and antimicrobial in vitro research is robust. Use grated fresh in slow-cooked dishes or dried and ground in soups. But the next item, the long pepper, the spice that the Persian Muslim physicians documented as a carrier, and the first step in the bridge to our climax. Number 6. Long pepper. In Arabic, filfil hindi, the Sanskrit name pipali. Distinct species from black pepper, Piper longum versus Piper nigrum, same genus, different species. Long pepper actually preceded black pepper in early Muslim and European markets. Ibn Sina catalogued the peppers separately and prescribed long pepper as a respiratory and warming spice. What matters here is what comes next. Long pepper is the richest concentrated source of piperine, the active alkaloid. Piperine does something extraordinary. It dramatically increases the absorption of other compounds taken with it. Multiple peer-reviewed sources confirm long pepper is the dominant natural source of piperine used in modern bioavailability research. Drug interaction caveat. Concentrated piperine inhibits the CYP3A4 enzyme, which affects many prescription medications. Use long pepper sparingly in stews. But the next item, the Yemeni cousin of pepper, with a completely different active compound. Number 5. Cubeb pepper. In Arabic, filfil al-Sini, meaning Chinese pepper, despite its Indonesian and Yemeni origin, a classical naming convention. Ibn Sina specifically named cubeb, distinct species from long pepper and black pepper, Piper cubeba, same genus, different species, different active compound. Cubeb's primary active is cubebin, not piperine. Cubeb was used in classical Tibb for urinary disorders, respiratory complaints, and oral health. Modern human research is thin, be honest. Most of the data is preclinical antimicrobial and antifungal work. A 2019 study confirmed antioxidant activity head-to-head with black pepper. Safety note: concentrated cube extracts may interact with diuretic medications. Use sparingly in cooking. But the next item, same species as black pepper, processed differently, and a Sunnah-era technique. Number 4. White pepper. In Arabic, filfil abyad. Same species as black pepper, Piper nigrum, different processing. The ripe berries are soaked, fermented, and the outer hull removed. Sunnah-era processing technique. Ibn Sina catalogued white pepper separately from black, noting it as milder and used in finer Sahaba-era kitchens for less visible coloring. Modern research on white pepper largely tracks black pepper research, with the caveat that white pepper has slightly lower piperine concentration due to pericarp removal. A 2025 comparative study documented the differing volatile profiles of white and black peppercorns from various regions, used in light-colored cream sauces, soups, and dishes where the color of black pepper would be unwanted. But the next item, the king of spices itself, and the molecule that unlocks the climax. Number 3, black pepper. In Arabic, filfil aswad, the king of spices. Sunnah-era Indian Ocean trade staple, documented in Ash-Shama'il al-Muhammadiyya Hadith 177, where Salma describes preparing a barley dish for the Prophet's, peace be upon him, grandsons, in which she crushed pepper and spices. A Daif Isnad narration, so we cite it honestly as Sunnah-era food record, not as Sahih medicinal endorsement. Ibn Sina catalogued black pepper extensively, and here is the climactic bridge. In 1998, Schober and colleagues published a landmark study in Planta Medica documenting that taking piperine, the active compound in black pepper, with curcumin increases curcumin's bioavailability in human volunteers by 2,000%. The Prophet's, peace be upon him, pantry kept turmeric and black pepper side by side. The classical Muslim physicians paired them in formulations. Modern peer-reviewed research has now revealed exactly why. Use freshly cracked black peppercorns. Drug interaction caveat. High-dose piperine supplements interact with statins, immunosuppressants, warfarin, and CYP3A4 substrates. But the next item, the third Sunnah-era preparation of one remarkable plant. Number 2, fenugreek leaves. In Arabic, hulba, but specifically the dried leaves, called kasuri methi across Indo-Pak Muslim kitchens. The Prophet's pantry fee one covered fenugreek oil. Today, the dried leaves, a distinct Sunnah-era preparation of the same remarkable plant. A note of transparency. The famous weight of gold hadith attributed to fenugreek has been graded weak by scholars, and we do not anchor on it. We anchor on Ibn al-Qayyim and Ibn Sina, both of whom catalogued fenugreek extensively. The leaves carry a different compound profile than the seeds: chlorophyll, vitamin K, iron, and beta-carotene. Modern human research exists. A 2,000 randomized trial in the Eastern Mediterranean Health Journal gave 20 male volunteers an aqueous extract of fenugreek leaves and documented significant blood glucose reduction. A clean human clinical trial on the leaf specifically. A 2023 study documented fenugreek leaf wound healing. A 2024 review confirmed both seed and leaf preparations carry overlapping but distinct activities. Safety caveats: hypoglycemic interaction, pregnancy caution, legume allergy cross-reactivity, and the maple syrup body odor from the sotalone compound is harmless but worth knowing. Sprinkle dried kasuri methi on lentils, curries, or breads. And the next item, the climax, the single most studied medicinal spice on earth. And number 1, the spice the Prophet's, peace be upon him, pantry kept beside the black pepper, the spice Ibn Sina prescribed for the liver and the joints, and the spice modern medicine has now studied more than 2,000 times. Turmeric. In Arabic, kurkum. We anchor honestly. There is no direct Sahih hadith naming turmeric, but the classical Islamic apothecary is unmatched in its documentation. Ibn Sina catalogued curcum in the Canon of Medicine as warm and dry to the 2nd degree, prescribing it for jaundice, liver complaints, joint inflammation, wound healing, and decocted in water with honey for stomach disorders. Ibn al-Bayṭār documented multiple traded varieties in the Andalusian Pharmacopoeia. Al-Razi included turmeric in his Hawi. The Indian Ocean trade brought turmeric into Persian, Andalusian, and Madinan apothecaries. By Ibn Sina's time around the year 1000, turmeric was a major component of classical Islamic medicine. And then modern science arrived. More than 2,000 peer-reviewed studies on PubMed. Curcumin, the primary bioactive, inhibits NF-kappa B, a master inflammatory pathway documented in the Agarwal Review series. The daily 2016 meta-analysis in the Journal of Medicinal Food pooled 8 randomized trials and found 1,000 milligrams of curcumin daily reduced osteoarthritis pain, comparably to ibuprofen, with fewer side effects. The San Mukani 2014 trial in phytotherapy research randomized 60 patients with major depressive disorder to curcumin 1,000 milligrams or fluoxetine 20 milligrams and found comparable response rates of 65 and 63%. The small 2018 trial in the American Journal of Geriatric Psychiatry documented 18 months of therakermin-improved verbal memory and reduced amyloid and tau accumulation in older adults, and now the bridge from number 3. In 1998, Schober and colleagues in Planta Medica documented that piperine increases curcumin bioavailability by 2,000% in human volunteers. The prophets, peace be upon him, pantry kept turmeric and black pepper together. The classical Muslim physicians paired them in their formulations. Modern peer-reviewed research has now confirmed exactly why this pairing matters. But we are honest, the Sahih 2014 lipid analysis was negative. Turmeric does not lower cholesterol significantly. The cancer evidence is preclinical and not yet a treatment recommendation. Safety caveats. Turmeric interacts with blood thinners, hypoglycemics, immunosuppressants, and CYP3A4 substrates. It is contraindicated in active gallstones because it increases bile flow. Discontinue 2 weeks before surgery. Pregnancy supplements should be avoided. Culinary use is safe. And a critical sourcing note, lead chromate adulteration of turmeric has been documented in South Asian markets, with child blood lead levels measured at 10 times the CDC threshold. Buy curcuminoid standardized turmeric from tested sources or culinary turmeric from suppliers with lead testing. 1,400 years after the apothecary of Ibn Sina, peer-reviewed research is still trying to understand why turmeric was on the Muslim physician's shelf. The Sunnah was never lost. It was only forgotten. That was 20 Sunnah spices. Hit subscribe. Next time on the Prophet's Pantry, 20 Sunnah tonics that will heal you instantly, closing on the blend the Prophet, peace be upon him, named in Sahih al-Bukhari as the cure for every disease except death, combined with the spice we just covered. Don't miss it. May Allah bless your home with healing and barakah. Assalamu alaikum wa rahmatullah.